Okay, this video is what is the conventional healthcare pyramid? So here's how it works. Um, at the top is Big Pharma, and Big Pharma has a bunch of employees, in a sense, who do the research at the big name universities. I wrote in here Ivy League liars, and the Ivy League is full of people who do this sort of thing, but there's a lot of these types of persons at other famous universities. So when I hear researcher, when I was a young guy, I thought, oh, that's great. They're doing scientific research, improve knowledge of medicine. Now I think of it in a quite a different way. Most medical research is just, lying, okay? It's just a way to market a drug. And these guys lie all the time. And I did some of my training at Harvard, and I can tell you, I knew the guys there. They are not your friends. Their job is to figure out how to make money for a pharmaceutical company so that they can get grant money for themselves. That's what it's all about. Okay, so they don't care what happens to the patient. And that's also why Big Pharma is smart. They've got billions of dollars. They hire very smart people. They do a lot of research. They know the truth. They know their drugs stink. They know their drugs don't help people most of the time. But they don't care because there's tons of money. There's billions of dollars in selling drugs, okay? And they hate the patients. Patients to them are stupid talking monkeys. That's what I told you about this atheistic Darwin stuff. It's a big deal because by definition, a person is just a talking primate, talking ape, monkey. They consider them useless eaters, a waster of the world's resources. So what if they die? It's good to not waste the resources of the world. They just want their big money, okay? And they are good at getting it. So what I'm saying is, even though they're a very small percentage of the people in healthcare, between Big Pharma and the Ivy League liars, I call them, the ones who do the fake research to grant them the so-called respectability, legitimacy to sell their fake drugs, that's where all the big money comes from. That's where most of the big money comes from. There's also some big money involved in, doing unnecessary surgery and things like that. But that's the big, big, big part of the money. Okay. And again, that controls everything. All right. The entire conventional American medical system is based on the idea that the standard way to treat a disease is give a drug, match the ill to the pill, and send a pill. But in reality, that's seldom the deal. Most diseases are due to diet and toxicology. Fix the diet, avoid the toxins. But there's no money in that. There never will be money in that, probably on a large scale. So that's why it doesn't catch on. Okay, the hospital owners. Hospital owners are quite often business people. We're talking about like private practice hospital. There'll be some MBA or a business corporation that owns a hospital. Maybe a pharmaceutical company will buy a hospital. And these are people who are more business focused. They don't usually know much about medicine. And they'll usually hire some spokesperson, an MBA. It might be a doctor or a nurse practitioner, but it's always going to be somebody whose focus is on the business, okay? And they're going to talk to you about how they're improving healthcare. And when they say they're improving healthcare, what they're talking about is productivity or volume. We generated so many diagnostic tests, so many surgical procedures, and all this stuff, and they pretend that that's an indicator of quality. Of course, it's quality. It's always a standard of care. And they'll have a spokesperson, maybe a likable person with some healthcare training, but it'll always be somebody who's really just a representative who does exactly what they're told. Okay, the persons behind the scenes are running the show based on money and control of things. They don't care about patients. The patients are really irrelevant for the most part. At the next level, when people think of a healthcare, what do they usually think of? They think of a doctor, a nurse, a physical therapist, a dentist, something like that. Maybe even a PhD psychologist or something. And these people are relatively well educated with expertise in their own narrow area. So if you look at a physician, people think doctors are so educated. I can assure you they're not. I mean, doctors go to med school wanting to help patients, but most doctors majored in biology in college where they learned a bunch of stuff that was irrelevant to healthcare. They just did what they were told, got their grades. They worked very hard, but the reality is you don't learn about health in medical school, okay? You learn about drugs and how to prescribe drugs. It's all about selling drugs, okay? There is, of course, some additional knowledge to that, and the surgeons know surgery, the pathologists know pathology, but the point I'm getting at is most of them have a very specialized knowledge in how to generate the billing codes for their field. That's what they're paid to do. That's why a hospital hires them in particular is to generate billing codes. And you will say, well, isn't it to help the patient cure the patient? And I'm going to tell you something. It's going to sound bizarre, but it's true. I don't think I've ever been at a single hospital that ever Well, let me just put it this way. I'm not going to make all these giant statements, but I'll just tell you one thing. Hospitals track productivity. How many surgeries did the cancer surgeon do? Okay? But you will almost never in your life see anyone tracking outcomes. How many patients are cured or improved, unless it's part of a research study, which is rather bizarre because if you think about it, if you're a sports team, you want to know. Look at baseball. They keep tons of statistics. How many games does the pitcher win? What's the pitcher's earned run average? Okay. They're all over statistics with athletes because they really care about outcomes in sports. Does the team win? When the team wins, everyone's happy. The fans, the coaches, the owners, the athletes, okay? But in medicine, it's usually considered irrelevant what happens to the patient. And you could say, how could I say that? And the reason is the attitude is as long as you provide the standard of care, you've done what you are expected to do, and nothing else really matters, okay? Whether the patient gets better or not, that's irrelevant, okay? And there is some good reason for that. The good reason for it would be is if they only went by outcomes, then the patients with really bad disease who you could predict were going to have a bad outcome, they might get shunned. No one will want to see them if it's going to make their statistics look bad. On the other hand, the reason why they don't keep statistics is because if you're prescribing drugs to treat diseases due to diet and toxicology, your cure rate is going to be zero. That is not a misstatement. Zero. By definition, conventional medicine defines things like hypertension, diabetes, and whatnot as chronic diseases, saying chronic to mean that they are never ever cured. They're just managed. Okay? And I can tell you, the doctors, nurses, physical therapists, they like the patients. A lot of the patients are pretty messed up. When I say messed up, lots of them are alcoholics, drug addicts, cognitively impaired, really kind of sad and pathetic. That's also why, doctors behave the way they do when they talk to people. They're very, hi, how are you? They talk very slow and polite and kind of dopey. And that's because they're so used to talking to old people that are mildly, barely with it. It's considered an achievement for a patient to be A&O times 3, alert and orientated times 3 to person, place, and time, okay? So they're very used to dealing with cognitively slow people. And so that's why they always start out a conversation kind of slow and dopey and formal. The other things that weaken them, like I said, they don't know anything about nutrition. They don't know anything about toxicology. It's considered inappropriate to talk about religion. But, those are actually major components of healing. And they seldom talk about stuff outside of, what is expected in their field. They're usually very conformist. They're not free thinkers. The way they made it through pre-med and med school and residency is by being conformists, doing as they're told. Medicine's very hierarchical. If you want to get ahead in medicine, you do as you are told. You follow the rules. You respect the hierarchy. So they play it safe. And by playing safe, I mean they just go by the standard of care. As long as you follow the standard of care, this disease, for hypertension in this level, in this category of patients, this is the first drug. So as long as you prescribe that drug, no matter what happens to the patient, you cannot get sued. And also, you will get paid. On the other hand, you start doing stuff like you talk about Kempner's, rice diet or something for control of hypertension. That could take tons of time. You won't get paid a cent. You'll get behind on your schedule. The other doctors in your hospital, your clinic, or wherever you work, there'll be some bean conner who keeps track of the doctors saying, how come, so-and-so who prescribes tons of drugs saw 30 patients today, and you, Mr. Big Talker, Mr. Nutrition, you only saw 10 patients or 15 patients. You're not pulling your share. You better not, you better get your act together and start seeing 30 patients a day or you're fired, okay? So they have to do that if they want to keep their job in most medical fields, like let's say internal medicine or something. All right, and then what is actually the bulk of persons, the majority of persons that work in a hospital? It's usually people with less education, something like a 2-year degree or no college training at all, technologists, clerks, secretaries, transporters, greeters, and a whole bunch of other related jobs in some way. And these groups of people, they tend to love the patients. They themselves often have healthcare problems at a young age. They're often patients themselves. And they are sort of one with the patients. And they love the patients. And they're very nice to the patients. And the patients often remember them as part of their experience. Okay, so what I'm trying to say is control comes from the top down. Big Pharma, the docs down here say, well, gee, the Ivy League docs are real smart, probably had to have really good board scores to get in the Ivy League. They know what they're doing. So especially when they're young, they really trust the Ivy League doctors. Then what happens is, as they get older, they start approaching 50, and they're kind of like, even by 45, they're like, How come my patients never get better? How come these patients have such terrible outcomes? How come all these patients are deteriorating, becoming cognitively declined, physically impaired? You know, something's wrong. What we're doing doesn't work. Docs tend to realize that. The smart ones start realizing it by about 45. The less bright ones start to realize it maybe by 55. But they know they've invested their whole life in this. They know as long as they play it safe, prescribe the drugs, practice the standard care, generate their billing codes, they will collect their money. So that's what they do. There's no incentive to do anything else. Very, very few are curious or read on their own. I know my doctor buddies, and I can tell you the really smart ones. Let's say average doctor has an IQ 120 to 125. The guys with an IQ about 130, they might read a book once every 2 months or so, and they'll talk to me sometimes about their books. The brighter guys are going to be reading maybe, a book a month, 2 books a month or something, and they'll sometimes talk to me about their books. But not many of them are reading papers. I'll almost never hear a doctor tell me they read an interesting paper. That almost never happens, okay? It's only the really smart ones, somebody like McDougall or some of these other doctors. They're cranking through the literature and learning stuff and you have to read the literature outside your own field. In your own field, the literature is typically going to be very narrow. If you open up a medical journal, I will tell you 95% of the papers will be worthless, just statistical manipulation of stuff that everybody already pretty much knows. It's that extra 5% where you might find something good. So anyways, I just help you understand this, and this is why healthcare can't not change. It will never change, because the big pharma and the grant money going to the Ivy League famous medical centers, they want that to continue. They're making millions and billions of dollars, and then all the rest of them are just controlled by this, so it's never going to change. But once you understand it, you will have more reason to be skeptical when you're getting BS'd, and you'll be more able to understand why you need to seek additional information, especially if your problem is diet and toxicology, or personal religions in that sense, psychological. So anyways, hope that helps.